Welcome to Finding Strength in Movement, Role of Exercise in Cancer Prevention, Treatment, and Survivorship. My name is Savina Chacheva and I'm the Program Director at the Cancer Wellness Center. I'm so glad that you can all join us today. For those of you who are joining us for the first time, I would like to share a little bit more about the Cancer Wellness Center. Each year, our free counseling services, support groups, health and nutrition programs serve over 2,000 community members of all ages and backgrounds. People with cancer, family members, friends, and caregivers all come to us to connect and cope. Our services, which are both virtual and in person, include education programs like the ones today that aim to help you navigate the very challenges that come with living with a cancer diagnosis, wellness classes like yoga, meditation, nutrition, exercise, and more that provide a holistic approach to healthy living, and support services including counseling for individuals, families, couples, children, as well as those bereaved, and support groups that are designed to help our participants manage the mental and emotional impact of cancer. If you would like to learn more about the Cancer Wellness Center and connect to our free programs and services, please visit cancerwellness.org, and the link will be included in the chat. Now I would like to welcome our presenters, Maggie Keller and Sarah Reynolds, who are here to share more about the importance of movement. Welcome.
Thank you, Savina, and thank you so much to the Cancer Wellness Center for having us here today. We're so excited to present to you on one of our true passions, finding strength in movement. I am Maggie Keller, and this is Sarah Reynolds. We are hematology oncology nurse practitioners and the founders of the Integrative Oncology Clinic at Endeavor Health Cancer Institute. We have no conflicts of interest to disclose today. So our agenda for today, we will be talking about the data and the research that supports the impact of exercise in cancer prevention, in cancer treatment, and as a cancer survivor and thriver. We will also talk about how to start moving and increasing your physical activity, as well as opportunities at the Cancer Wellness Center. Exercise and cancer prevention. Of course, we know that no one thing causes or prevents cancer. Research shows that living a healthy lifestyle and moving more can lower the chances of developing certain types of cancer. Exercise is one of many tools we have to support our health, and we want to highlight today how the evidence supports physical activity and its impact on cancer risk. In preparing for our discussion today, we spoke with some of our patients at Endeavor Health Cancer Institute to hear firsthand how exercise and movement has benefited them along their cancer trajectory. We were so motivated and inspired by them that we wanted to share them with you today. Stories of strength. I move my body to keep myself healthy and strong for as long as I can. I try to do exercises that strengthen my heart, bones, and mind. Having recovered from cancer once, I want to do everything I can to reduce my risk of another diagnosis, so I have made exercise a priority. Here we have a graphic from the Center for Disease Control. We know that research shows that physical activity lowers the risk of developing at least 8 cancers, including cancer of the esophagus, lung, stomach, endometrium, breast, kidney, colon, and bladder. Cancer prevention generally relies on lifestyle modifications like smoking cessation, decreased alcohol consumption, and nutrition, along with vaccinations such as HPV for cervical cancer, and screening protocols like routine mammograms and colonoscopies. There is growing evidence and data that supports a more prominent role for physical exercise in cancer prevention. The CDC currently reports that 1 in 4 adults adequately meets guidelines for aerobic and muscle strengthening activities per week. These guidelines are laid out by the American Heart Association and the American Cancer Society, which recommend 150 minutes of moderate activity or 75 minutes of vigorous activity throughout the week. The World Cancer Research Fund and the American Institute for Cancer Research recently updated these guidelines based on the latest evidence, recommending up to 300 minutes of moderate activity or 150 minutes of vigorous activity throughout the week. They also recommend strength training, resistance or weight training 2 days per week. Move more and sit less is a simple and powerful slogan from the American Cancer Society, and it's easy to remember. You don't have to make a radical change to feel a difference. Even the smallest change in movement can make a big impact. The physical activity research, as it relates to cancer prevention, primarily focuses on aerobic exercise. There is a lack of strong evidence for the role of muscle and strength training in relation to cancer prevention. So for our purposes here today, physical activity relates to aerobic exercise and its role in cancer prevention. We are seeing more and more data emerging, highlighting the impact of physical activity. The American Cancer Society guidelines for physical activity are based on data and research. Evidence-based support shows physical activity role in cancer prevention. We know it affects various systemic function, including improved cardiovascular health, improving your body's ability to break down sugar and our body's sensitivity to insulin, improving immune function, decreasing inflammation, regulating sex hormones, which are important to hormone-sensitive cancers like breast and prostate, and decreasing oxidative stress, which can cause cellular damage and inflammation, among other damage. But how? How does physical activity impact your body? This here is a rather cumbersome slide from the Journal of Sports Health, but it's important. It shows us the molecular mechanism behind physical activity and its role in cancer prevention and recovery. Movement actually changes what is happening in your body at a cellular level. Start in the center of this diagram with you as a runner or a walker, for example. As we move out into the orange ring, we see the impact of physical activity, like a lower risk of cancers, reducing side effects of treatment, and strengthening the immune system. As we move into the outer ring, we see how the pathways and mechanism of action. Physical activity improves blood flow, oxygen delivery, it reduces harmful inflammation, it regulates hormones that affect cancer growth, it triggers cancer cells to stop growing, it activates immune cells that patrol for cancer cells. You do not have to remember these pathways or how they work, but it is what matters is the strong biological evidence that exercise affects cancer at the deepest level. Not just good for your heart or your weight, it's changing the environment in your body to make it less friendly to cancer. Small amounts of movement make a big change, even at a cellular level. The data supports the evidence for exercise and cancer prevention. The risk for colorectal cancer was found to be 19% lower for individuals who had higher levels of exercise than those with lower levels. A meta-analysis of 25 observational studies in lung cancer suggests physical activity is associated with a reduced risk of lung cancer among former and current smokers. In breast, they saw increased moderate vigorous physical activity was associated with lower sex hormones and a lower risk of postmenopausal disease. The British Journal for Sports Medicine highlighted that just 75 minutes of moderate intensity exercise per week, the equivalent of just 11 minutes a day, can lead to a 7% decrease in all cancer risk. Now that we've seen the impact of exercise and cancer prevention, we'll hear some more about exercise and cancer treatment.
Thank you. Here are more stories from our patients. When I was first diagnosed with multiple myeloma, it made me feel like I didn't know my own body. It was a huge shock. Likewise, following my stem cell transplant, I felt weakened and didn't trust that I would ever get back to the level of energy I was used to. As I recovered, it was a great comfort to slowly return to any form of exercise, but particularly walking and riding my bike. Every time I felt the increase in heart rate and my muscles move, it encouraged me and gave me a sense of strength and happiness. Stem cells transplants are a miracle, but exercise is the way back to trusting your body again. I am so grateful to be able to move. And consistent exercise has been an essential part of my cancer management. I do daily strolls with friends, walk to and from my chemotherapy sessions and other appointments, 4 miles round trip, and work on strength training weekly. I'm absolutely convinced that regular exercise has greatly reduced the side effects of chemo, and there's nothing like a brisk walk on a beautiful day to help me clear my mind and focus on all the good things in my life. We are all aware that cancer treatments, so chemotherapy, immunotherapy, surgery, and radiation, can have numerous side effects and a negative impact on all body systems. It can cause heart and lung toxicities, nausea, vomiting, constipation, diarrhea, sexual side effects, endocrine disorders like thyroid problems or difficulties regulating sugars, osteoporosis, osteopenia, skeletal fractures, that very popular chemo brain or that short-term memory loss, difficulty concentrating and fatigue, anxiety and depression, decreased blood counts, and decreased immunity, among others. Knowing this, some authors published a systematic review in 2022 linking the benefits of exercise to these symptoms. They reviewed 36 papers between 4 years, showing that physical activity decreases the severity of side effects of cancer treatment, reduces fatigue, improves quality of life, has a positive impact on mental health, improves aerobic fitness, reduces risk of cancer recurrence, and even death. Their conclusion was that physical activity is recommended for patients with all types of cancer and at all stages of treatment. When we categorize the impacts of physical activity, we can see its long-reaching effects. As previously mentioned, decreased fatigue, reduced physical deconditioning, improved bone health, so decreased risk of osteopenia, osteoporosis, and fractures, reduced incidence of and severity of chemotherapy-induced peripheral neuropathy, so that's the numbness and tingling or burning or heaviness or pain in the hands and feet that patients can often describe with certain types of chemotherapy. It can improve mental health, so improve self-esteem, reduce feelings of anxiety and depression, improve sleep quality, improve physical and social quality of life, and even decrease the risk of problems in the future. So decreased risk of secondary cancers, decreased rates of recurrence, and decreased risks of developing coexisting conditions that can make treatment more difficult. So all the major health organizations agree to the benefits of exercise. And this is from the National Cancer Institute, again, showing the many benefits of exercise on cancer-related symptoms. What type of exercise depends on the condition of the individual, and we certainly want to take into consideration certain factors before prescribing an exercise program. So first and foremost, we want to recognize limitations and ensure safety in exercise and movement. These exercises must be tailored to each individual patient. So what do you like to do? What time frame are you looking at? What type of exercise are you interested in? What intensity is realistic or feasible to do, and what's our goal of exercise. We must also consider coexisting conditions when developing exercise regimens. So, for example, folks with cardiovascular disease, osteoporosis, anemia may have more difficulty with certain exercises, and we need to adjust for that. We want to know physical limitations before and after diagnosis. So what were you like before this diagnosis, and how can we get back as much as possible to that baseline? We should know your prior relationship with exercise. Did you like exercise to begin with? What do you want to recreate, or what do you want to stay away from? And then we certainly need to be aware and recognize that certain socioeconomic factors can create barriers between access to and cost of exercise. And finally, exercise as a cancer survivor and thriver. More stories of strength. Exercise and movement gave me mental and emotional strength. It helped me stay positive for myself and loved ones during all phases of treatment. When I was feeling my worst, a quick walk with my best friend lifted my spirits tremendously. Post-treatment, it fills my soul with gratitude. I am blessed I can move and strengthen my body. My connection between my mind and body has never been stronger. Exercise and movement has been a touchstone for me throughout this journey. It's something that I could do before, during, and after as I navigated breast cancer that helped me feel connected to my body and that I was still in control in some way. Some days it allowed me a sense of normalcy, other days it allowed me to forgive my body, and now it gives me a sense of strength that I can move past cancer. I definitely didn't want to do it every day, but movement can look different daily, especially if you have an accountability partner, a kid or a spouse that will take a walk with you, or a friend in another city who's doing the same workout that day. Those have been the things that help clear the fog of what you're going through and feel a little better day by day. So your cancer treatment is over. Now what? We know that the benefits of exercise extend long into survivorship once treatment is over. A study in cancer survivors showed that over 32% of participants reported improvement in cognitive function with physical activity. We know that physical activity decreases treatment-related fatigue, improves ability to do daily activities, or gives better energy and mood, increases sense of well-being, and enhances sleep and recovery. We have data that supports impacts on survival as well. Just this spring, the New England Journal of Medicine published the Challenge trial, which was a Canadian randomized control trial of almost 900 patients at 55 cancer centers in 6 countries. The participants were stage 3 or high-risk stage 2 colon cancer patients who completed standard surgery and chemotherapy. They were randomized to either the exercise group or the control group that received health education materials only over a 3-year period. At 5 years, 80% of patients in the exercise group remained disease-free versus 74% of patients in the control group. And at 8 years, disease-free survival was significantly longer in the exercise group than in the health education only group. The principal investigator and lead author of the paper wrote that exercise is not just an intervention for quality of life and fitness. This is an intervention that improves survival and should be standard of care. Another group showing improvements in survival were within the breast cancer population. So patients with high-risk breast cancer who met the minimum guidelines for physical activity both before diagnosis and after treatment appeared to be associated with a statistically significant reduced risk of recurrence and mortality. And patients with advanced breast cancer in another study showed those who engaged in physical activity for 1 or more hours per day at baseline had an increased likelihood of survival compared to those who exercised less than 1 hour per day.
Instead of thinking of exercise as a small moment in time, we love to think of it as increased movement over your whole 24 hours. Make every step and minute count. This is a philosophy we find motivating and inspiring. Every minute of your day counts, and any added movement is beneficial. This includes your daily routine rituals of daily living, like casual neighborhood walks, chores, gardening, or taking the stairs instead of an elevator. All contribute toward a healthy 24 hours. We also recognize the benefit of decreased sedentary time with a goal of no more than 3 hours of recreational screen use and trying to break up long periods of rest or setting limits on your phone to give you a little wake up. It's time to get up and move around. We also want everyone to prioritize their sleep. Get enough rest every night with consistent sleep and wake times. So along the guidelines to sit less and move more, this is a diagram of the power of movement snacks. We love movement snacks. You don't need a full workout or a long stretch of movement at one time to feel better. Sometimes this can help you build your endurance or just break up long stretches of sitting or screen time. Movement snacks are short bursts of energy or activity, even 30 seconds only, up to 5 minutes, to get your body moving and your heart pumping and your energy up. These are some good examples to try, like marching in place, taking a walk around your kitchen, or up and down your stairs a couple times. Seated leg lifts, if you need to stay seated, sometimes just lifting your legs, strengthening your legs, or calf raises can help boost your energy and ease stiffness. Arm circles can help loosen up your shoulder, strengthen your neck and upper body. And wall push-ups are a great way to build strength by using your own body weight without any added equipment. Something is always better than nothing. Even a few minutes of movement throughout your day can make a huge difference in your health and recovery. We also want to recognize that you should get help when you need it. Talk to your provider. Tell your doctor, your nurse practitioner, your nurse that you're interested in moving more or interested in physical activity or exercise. At your institution, you may have a cancer survivorship program. At Endeavor, we have a survivorship group that offers many beneficial lectures and workshops. You may also have a dedicated cancer rehab program. We have one in Swedish Hospital that helps with deconditioning and treatment and motor-related treatment difficulties and more. We also recommend the integrative oncology group like ours at Endeavor. Integrative oncology is a field of combining evidence-based complementary modalities with conventional cancer care to improve quality of life and decrease symptom burden. We spend a lot of our time with our patients talking about lifestyle modifications like exercise and movement, nutrition, mindfulness and meditation, and stress reduction. Physical therapy and occupational therapy are always helpful with post-surgical challenges, balance issues, deconditioning, neuropathy. Sometimes getting a personal trainer or athletic trainer can be super helpful to identify safe ways to build endurance or start strength training. The Cancer Wellness Center offers classes and wellness programs, as Savina was mentioning, and we'll go into more detail about that in just a minute. And we always encourage including friends and family and children and pets into your routine to make it more fun, maybe establish accountability, and just to find joy in the movement. This is Sarah and I on top of the Camelback Mountain in Arizona. We both strive to find movement every day that brings us joy and hope you can too. Whether that's pickleball, a walk with a friend, or just 2-minute movement snacks throughout the day, any and all movement matters and is beneficial to your mind and body, as the evidence clearly shows. We appreciate your time and thank you so much for being here. I'll hand it over to Savina here to go into the Wellness in Action program at the Cancer Wellness Center.
Thank you so much. This was really informative, and I really appreciate you speaking to our participants today and sharing some of these inspirational stories as well. So our Wellness in Action initiative is actually this is considered our kickoff to the program. So for the next 2 months, we want to encourage you all to join us in some movement. In addition to the regular classes that we will be hosting at the Cancer Wellness Center, like our gentle yogas and strength and conditioning, we will have some one-off programs like pickleball that was mentioned, as well as bands and exercise with bands, longer walks in the community. We have one in a couple of weeks, as well as Pilates and Zumba and other classes. So please stay tuned on our website, and I will put the link in the description here, in the chat here. This will list all of our upcoming programs that you can participate in. Part of in the wellness initiative, what we will do is have a punch card where you can keep yourself accountable and keep track of some of the classes that you do, and have the opportunities to win some prizes on the way. So for the first 6 classes, you could get a chance to get a special gift. And then once you reach 12 classes, you will be entered to win a $100 gift card. So we really hope that you will join us. Again, this program was the kickoff, so starting tomorrow, you're welcome to join any of the classes. I will also send a follow-up email that lists everything that is coming up, so you don't need to worry about remembering or looking on our website trying to see what fits. We will communicate that. If you follow us on social media, the classes will be posted every Monday as well. I think you have one more slide. Great question that just came in. So no, the program is not on-site only, although some of the special classes are on-site, like the pickleball, obviously will have to be on-site. A lot of these classes can be accessed virtually. So we really are trying to make it inclusive to everybody, whether you're in person or virtual. That will be annotated on the calendar, so you will see your options. And you're still eligible to win $100 if you participate in the virtual classes, so it's not exclusive to the in-person. So I think we're at a good point to begin questions. So please feel free to include them in the chat. As you were speaking, I had a couple that I generated myself. One of the common responses in our pre-survey from our participants was that they understood the benefits of exercise and they know that it could be really helpful, but have lack of energy. So cancer treatment often leaves people tired. So what would you say or recommend to somebody who's maybe interested and knows the benefits but is tired?
Absolutely. The one of the number one evidence-based ways to fight fatigue is with exercise, which is really challenging and of course feels like, yeah, counterintuitive. How am I supposed to move if I'm tired? And I totally understand that. I think a lot of times we do talk about those movement snacks, and you don't have to be going for 20 minutes in a row. It can be 2 minutes every hour. And at the end of the day, that's really added up to quite a lot. So it ends up being super beneficial, and starting as small and recognizing and giving yourself grace and trying to do just maybe 2% more every day. And then, of course, incorporating any additional help, like if PT could be beneficial sometimes, or a personal trainer that can also be helpful with decreased energy. Other thoughts?
We always say too, just do things you enjoy, and then it'll also come more naturally and more easily. Don't, suffer at the gym if you're not a gym person. Just go for a 5-minute walk, and then, try to make it even further the next day. So joyful and starting small.
Yeah.
Thank you. And that was one of the other questions I had is when you mentioned moderate exercise, I was thinking about the people who are maybe too tired and can't get that moderate exercise requirement. So what I'm hearing you say is the benefit even from those small movement snacks is still beneficial.
Oh, absolutely. I mean, those guidelines definitely that's for everybody. So don't expect to jump into vigorous activity. You want to stay safe and do what you can. And any movement is good movement and beneficial to you.
Thank you. One of the questions that came into the chat, and I think that's it's a great question and common concern is, this person said, how can I get around doing Pilates reformer, TRX, or boxing given the cost? So we know, at Cancer Wellness Center, all of our programs are free. I know they don't include the TRX and boxing, although we will be partnering in November with our local JCC, and we'll be using their equipment. So that will be an opportunity for you to try some of those programs. But also curious, Maggie, Sarah, do you have an answer as well?
I know there are a couple physical therapy, these are local to us though. There's one in Evanston and one in Wilmette that are associated with physical therapy. And so they use Pilates in their physical therapy. It's not exactly what you're looking for, but it can be possibly covered by insurance. So that would be something.
Also, we refer often to our community partners like you, but also like YMCA is a great place to start. It doesn't have to be these really expensive, fancy gyms or private, yoga studios. There's so many resources online that you can do at home on YouTube for free. So yeah, we try to help get creative for
Yeah, there's lots of mat
things.
Pilates on YouTube. That's actually very helpful and free.
Thank you. That is really helpful, and it's nice to know that insurance could cover some of it. So if anyone's interested in kind of trying to see what their insurance would do, just talk to their oncologist. Who would they connect to?
You probably need to look at your insurance kind of coverage and see what is through there. And then, if you have a provider, like a resource nurse or something that you could talk with who might give you more ideas then that's
Okay, thank you so much. We've got a little bit of chatter here in the chat about YouTube, so thank you for mentioning it. Yes, cancer wellness classes are recorded in our YouTube and are on our YouTube channel, so even if the time slots that we have on our website do not work for you, you can always watch something at a time that's convenient. A couple of other recommendations that came into the chat is our partner Wellness House. So they are located in Hinsdale. They're another cancer organization similar to Cancer Wellness Center that offers all of their programs free of charge. They are in multiple locations. So their main location is in Hinsdale, but I know they're often partner with other organizations. So go on their website to check out what they have coming up, as well as, I would recommend looking and searching cancer support organizations and their exercise classes. The other is Advocate Health also has a survivorship center as well. And then Maggie and Sarah mentioned the survivorship center at Endeavor. So I would recommend, doing some research and looking to see what classes are available. If you need help, let me know. I'm happy to help you do some searching to find something near you. Or make recommendations based on what you're looking for. A question came in about, can I send the link in the chat for YouTube? I will do so, and I will include it in our follow-up email. Maggie and Sarah, does Endeavor offer classes?
like exercise classes.
Exercise classes.
So we are now connected to Swedish, and Swedish Hospital in the city has really a great like oncology wellness program that has multiple like their Galter Life Center is there, and that's where patients the oncology patients, they have access to Galter for free, I believe. And so we do offer it, but kind of really only at that location.
Thank you both very much.